Hello, everybody, and thank you very much for joining this press conference ahead of World Family Doctor Day. My name is Haines. I'm the Communications Officer at WONCA, the World Organization of Family Doctors. WONCA has over 133 member organizations in 111 countries and territories with membership of about 500,000 family doctors. Last year, WONCA celebrated 50 years. And since 2010, every May the 19th, we've been celebrating World Family Doctor Day, an annual celebration of the importance and the good work that family doctors do in healthcare systems around the world. This year, the focus is on planetary health, and our slogan is Healthy Planet, Healthy People. We have assembled, we had 4 excellent speakers. Unfortunately, one of them is not going to be able to make it now. That is Enrique Falqueto de Barros, is a Brazilian GP and very strong advocate for planetary health. Unfortunately, he is his region in Porto Alegre in Brazil, in the province of Rio de Grande do Sul, has been hit with unprecedented flooding this week, and everything is disrupted in this region. So he sends his apologies, and well, it's I guess it's highly relevant to our discussion today as well on planetary health. So our first speaker, Professor Sir Andy Haines, is the winner of the 2022 Tyler Prize and a professor of environmental change and public health in the London School of Hygiene and Tropical Medicine. Without further ado, I'll hand over to Andy.
Well, thank you very much for inviting me to say a few words. And this concept of planetary health really embraces the links between the health of natural systems and human health. So the health of our patients essentially depends on the kind of earth systems that sustain the health of our civilization and our planet more generally. And we know now from recent scientific evidence that of the 9 planetary boundaries that have been documented to exist, including climate change, biodiversity loss, fresh water, land use change, and others, 6 of these planetary boundaries have now been breached. So we're now beyond close to or beyond the safe limits for these different Earth system changes, and another one of them is about to be breached.
Sorry, about this. Sorry.
Yeah. So the breaching of these boundaries has major implications for human health. Just to give you one example, climate change. Climate change has pervasive impacts and damaging impacts on human health around the world. We know, for example, that about 1/3 or more of heat-related deaths in recent years, based on studies in sites in 43 countries, these can be attributed to climate change. They wouldn't occur in the absence of climate change. And there are many other ways in which climate change can affect human health, affect the distribution of infectious diseases, water-related diseases like cholera, diarrheal diseases, mosquito-borne diseases like dengue, malaria, and other a whole range of other infectious diseases, including those zoonotic diseases transmitted from animals to human beings. But also climate change affects nutrition, affects crop yields and the nutritional quality of crops, and so it can increase undernutrition. And of course, it also increases the risk of wildfires with the effects on air pollution, increases allergies as a result of changing pollen distribution, and very importantly, drives more people into poverty, which has big implications for human health, and also triggers population displacement. So populations displaced by floods, droughts, and other extreme events. So the family doctors really are on the front line for many of these effects. They are experiencing, as we're seeing with our colleague Enrique right now, they are experiencing many of the impacts of these on their patients. But they also have a role in the actions that we must take in order to try to avert, as far as we can, the disastrous impacts of these planetary level changes on patients. And there are two types of responses. One is adaptation, so we can adapt as far as we can through more resilient health systems, for example, better heat wave early warning systems, better disease early warning systems. And these will also depend on the involvement of family doctors and primary care teams in order to be effective, because you have to communicate with the most vulnerable people in the population. It could be the elderly, it could be pregnant mothers, depending on where you are, it could be other groups as well. And it's really primary care teams that know where these vulnerable populations live and can communicate with them. But the other action we have to take is mitigation. And mitigation means cutting greenhouse gas emissions. We have to cut those very rapidly because we're really pretty well run out of time to keep below 1.5 degrees. We're pretty well at 1.5 degrees global average temperature increase, but we can still keep below 2 degrees, which is the sort of second level of aspiration of the Paris Climate Agreement, if we move quickly. But the good news story is that many of the policies we need to put in place in order to mitigate, cut emissions, are also good for human health. So as we move away from burning fossil fuels for generating electricity, for example, by burning coal, other fossil fuels, we also reduce air pollution. And there are about 5 million deaths a year, something of that order worldwide, from the air pollution caused by the burning of fossil fuels. And Alan, our next speaker, will talk more about that. But also sustainable diets, sustainable food choices, increased consumption of healthy, diverse, plant-based diets increasingly will help to prevent many diseases due to poor dietary intakes, but also reduce greenhouse gas emissions, reduce the pressure on land use and biodiversity loss as well, because the food system is driving a lot of this biodiversity loss. And then finally, physical activity. So the transport system often great dependency on the private car, particularly in built-up cities. If we can get more people walking and cycling using public transport, particularly if we make that walking and cycling safer, protect it from road hazard, then that can bring big benefits from reduced air pollution, increased physical activity. So they're just three examples. We can also give the example of better access to green space as well, which brings mental and physical health benefits. And the family doctors can help advocate for these changes, both at the policy level, but also with individual patients where appropriate. Well, I'll stop there and I'll hand on to the next speaker. Thank you very much.
Thanks very much, Andy. That's great. Our next speaker is Dr. Alan Abelsohn. He's in Toronto, Canada, a family physician, former chair of the WONCA Working Party on the Environment, now being named the Working Party on Planetary Health, and a specialist in air quality and environmental health, professor in the Dalla Lana School of Public Health in the University of Toronto. Thanks very much, Alan.
Oh, well, thank you. And it's a pleasure to be here. As you can see, the background is not urban Toronto. The background is a forest about 3 hours out of Toronto, which is quite an honor and a pleasure to be. So I want to start with just honoring family doctors and talking about their importance in terms of this challenge, the planetary challenge that Andy so well described. There's a family doctor in almost every community in the world. And the goal is to reach, to have a primary care practitioner, either a family doctor or a nurse in every community. But what they are doing is bringing evidence base into the communities, bringing science into communities. And as such, family doctors are consistently ranked as one of the most trusted sources of information in terms of science within their communities. And as such, and because of this, it's my belief that we can play a pivotal role in educating our patients and our communities about the interplay of the effect of the environment on our health and interventions to improve the environment, and in fact, save our world in this crisis of planetary health and climate change. And the other piece is that as family doctors in our communities, we see the impact that climate change is having on the health of our patients. So Enrique, right now in Porto Alegre, is seeing the impact of these severe floods on the community that he's in, which is cut off by road access and severe flooding affecting mobility and access to healthcare. In the area that I'm in, with the forest behind me, last summer we saw tremendous forest fires, which created air pollution problems across Canada and into the United States. So family doctors are in their communities and have a voice in their communities. I want to take Andy's broad presentation and bring it down to a smaller piece of the puzzle and the picture of planetary health, which is air pollution, which has been my focus. There are two reasons for this. The one is that we have extremely good evidence about the impact, the relationship between air pollution and impacts on health. We know that combined, that's outdoor air pollution and household air pollution is related to 7 million premature deaths annually. And those deaths actually come right into the doctor's office because air pollution exacerbates diseases that we're working with all the time. Cardiovascular diseases like heart disease, ischemic heart disease, strokes, heart failure, respiratory diseases such as asthma, COPD, and childhood pneumonia, and many other very common diseases, including diabetes, cognitive effects, skin changes. The relationship between air pollution and health got even more vivid. A few years back in London, a young girl, Ella, died because of asthma. When the coroner was examining the case, he concluded, and for the first time ever wrote on the death certificate, that air pollution was the cause of death. Air pollution exacerbated her asthma and caused her death. So as health practitioners, we're seeing the effects of this environmental problem, air pollution, on our patients. Our role is to educate our patients about the links between environment and health, air pollution and health, so that they can, in some ways, avoid the worst episodes of air pollution. Our role is also to encourage patients to reduce air pollution, so something like active transportation, riding a bicycle or walking to work, reduces air pollution and at the same time improves the individual's health. And we also have a role in joining the efforts to reduce air pollution. It's not just health sector or family doctors that are going to reduce air pollution, but we can add the health voice to the air pollution issue. And I've spent a lot of my professional time doing this. The interventions are related to multi-sectoral interventions. So reducing urban air pollution, reducing motor vehicles, managing forest fires. But the health voice, I think, is extremely important. And in conclusion, I want to just take us back to what I thought was a remarkable event. Last October in Sydney, Australia, was the World Organization, the WONCA International Conference. At that conference, there was one day that was called the Green Day, where all the family doctors wore green outfits. We also held a press conference, which was widely attended, and we urged governments across the world to end the proliferation of fossil fuels and in order to protect our climate and to protect our health. I just want to make the point that I think the voice of family doctors is very important in the ongoing struggles that we have to protect our planet. Thank you very much.
Thank you very much, Alan, for that. Moving on, our third speaker, as I mentioned, was Enrique. Enrique is based in Brazil, in Porto Alegre, and unfortunately, his area has been hit by severe flooding, and he's unable to make it today. So I would invite our fourth speaker, Dr. Andrée Rochfort. a GP, a family doctor from Ireland, a researcher and educator, focused on reducing healthcare's carbon footprint through sustainable practice. Over to you.
Thank you, Dermot. And I think the point that I would like to make today is that one person can make a difference. I'd like you to take a moment just to imagine that you're looking at a beach, and I'd like you to think of a child on a beach, a healthy, smiling, playful child who is singing, but the beach is dirty. There are plastic bottles and bags. There's broken glass. There's discarded nappies and face masks. There's food wrappers, tires, and metal. The water is polluted. I think this proves the point that we cannot have healthy people on an unhealthy planet. And the point about one person can make a change and make a big impact, because I think a lot of people, our patients and our profession, are a little discouraged and sometimes think that there's too much to be done. And it's understandable that people might think that there is a little point in any human taking any action because the problem is so big. We've just heard about the devastating floods in Brazil. But we can all make a change. We know the power in that one song by one singer can make all over the world and join people together and unite people together. So each of us, doctors, allied health professionals, patients, are leaders, and we're role models and advocates for planetary health and One Health. Because the actions of one person is multiplied by hundreds, by thousands, by millions, and even billions across the planet. Because one citizen, and we're all citizens together with our patients, we're citizens, whether we're family doctors, health professionals, patients, government officials, we are consumers, but we're part of a bigger organization. We're part of a community. We may be part of a member organization, part of the health service. So this brings in the interdisciplinary need to work together for planetary health and One Health, because the interdisciplinary strength feeds into transdisciplinary strength between health, education, housing, local authorities, transport, engineering, social supports, and all together with strong leaders in our policymakers, our planners, our local authorities, regional, national governments, and indeed international organizations like WONCA, WHO, and so on. That escalates the power of one person to many, many people. And scientists and experts are telling us to act, and we all need to listen. Planetary health itself is a new science. It's just under 10 years old. It was established in 2015, and the evidence will come when we act together. More evidence will come because we have a stakeholder role on this planet. And everything begins with one person. And I believe that today is the beginning of tomorrow. So I would like to leave you with that point in general, and to family doctors in particular. I come from a small island globally, and we have a member organisation, the Irish College of GPs, which in relative terms is a small organisation. But from the bottom up, 6 GPs, including 1 GP trainee, came together, working in our own time, in the evenings and weekends, and all of us will recognise that, to produce a GLOS toolkit, GLAS toolkit. And GLOS is the Irish word for green. It's open access. It's available online. If you do Google or search on your platform for GLOS toolkit. And in it, we highlight the actions that GPs can take as professionals in their practices, working with their staff, working with their patients. And the low-hanging fruit is prescribing medications and rational prescribing of antibiotics, but also social prescribing, nutritional advice, and lifestyle advice. And on the point of lifestyle advice, GPs and public health need to work much more closely together. We've learned how to work together during the pandemic, but public health, doctors and GPs need to work together because we serve the same population, the public. And we know the majority of the workload of primary care and the majority of mortality globally is caused by chronic diseases. And these need to be managed, and prevention is better than cure. So public health and GPs need to come together with the policymakers to bring patients with us on this journey, because managing chronic diseases, which are increasing, is core and key to what we as family doctors can do for the environment and for One Health, which is unifying the health of humans with the health of all living organisms. That's other mammals, animals, birds and fish, insects, microbes, and plants and trees, all of the plant life, with the environmental ecosystems that we all share, because we are all connected. Thank you.
Thank you so much for that, Andrée. At this stage, I'd like to invite some questions for our three panelists. You can raise your hand and I'll come to you, or you can write them in the chat. And while you think of your excellent questions, I just want to emphasize that, or highlight that the link to the Gloss toolkit that Andrée was referring to is in the chat as well. And I've had some really excellent feedback from doctors all around the world who've used this resource from the Irish College of General Practitioners. So have a look at that there. Also, I'm just going to put in the chat now a link to the first press conference. So just the second of two press conferences that we put on to try and cover different time zones. And there was 4 speakers this morning from the other side of the world. So if you like, you can have a look at that afterwards as well. And just a reminder then that next Sunday, it's May 19th, is World Family Doctor Day. And also in the also in the chat is a toolkit to help promote on social media our campaign and our key messages. So does anybody have any questions for our panelists? Or any comments? If not, I might pose a question myself to Andy. Andy, I saw a webinar that you gave in April speaking about the impact that climate change is having not only on physical health, but on mental health, and some studies that you cited in that regard. I wonder, could you talk a little bit more about that?
Sure, thank you. This is a very important topic because we used to emphasize that the physical health impacts of climate change, but it's become more and more apparent that climate change is, as you say, having an effect on mental health. And there are a range of different mechanisms or pathways by which that happens. First of all, people exposed to extreme climate events, whether it be wildfires, the kind of floods that Enrique is tackling at the moment in Brazil, droughts, these cause long-term mental health effects as well as the physical health effects. And that's partly related to the disruption of people's living patterns, partly related to loss of treasured possessions, partly related to the impacts on their wider family. But when you follow populations up, even quite long periods, over a year or so, you see that there's a high prevalence of common mental disorders like depression, anxiety, post-traumatic stress disorder, and so on. And so that's one way in which climate change impacts on health. But we also know that climate change is pushing more people back into poverty in many parts of the world. partly because of the extreme events, but also because as the temperature gets hotter, because it's more difficult to work outdoors or in air-conditioned environments. And that means that for many people, particularly many poor people, they're having trouble in undertaking the same level of work as they used to. So, for example, we're doing work with pregnant women subsistence farmers in West Africa, and we can see with them that it's having an effect on the fetus and on the mother. And we know that there will be and are being pushed more back into poverty, and it's more difficult to escape from poverty. And of course, that has big mental health implications as well. And then finally, even if you're not directly affected by climate change itself, we also know there's a lot of climate anxiety about, particularly in young people. So studies have shown that over 40% of respondents to surveys in a whole range of different countries, not just high-income countries, but middle-income countries and one or two low-income countries as well, have shown that a very substantial portion of young people are very concerned about climate change. And in some cases, nearly 50% of them say that it's having such an impact on an effect on their mental health, it's actually affecting their ability to function. So this is not just a trivial impact, it's a substantial impact. And that's caused by concern, very rational concern, really, about their prospects in an uncertain and potentially very hazardous future, due not just to climate change, but of course, also these other planetary level challenges that we've briefly touched upon. So yes, there are many, many effects of planetary level changes at the local level, of course, manifest at the local level on mental health. And the family doctors, other primary care workers are very much at the forefront and dealing with many of those. So it's really important to understand effective ways in which we can deal with and tackle some of these very pervasive mental health impacts. Thank you.
Thanks very much, Andy. Just also to mention that our colleague Pilar is here, and she can offer interpretation in Spanish if Pilar, if you want to just speak there and let people know.
Yes, of course, with pleasure. I'm just following the chat, and I set down that I can translate for them into English.
Okay.
There are two questions on the chat in English directly.
Yeah. The first one then is, what do you think the role of artificial intelligence and machine learning in planetary health will be in the next few years? I'm not sure if anybody wants to volunteer and speak about that.
Well, I can have a go if you like to start with, and then my colleagues may want to jump in, because it's something that we're getting increasingly interested in. And that question is a really important one, because machine learning, artificial intelligence approaches can help us to understand some of these complex changes that are occurring at the level of the planet, but also being manifest at the local level, because we're dealing with interactions between many factors, not just climate, but also loss of biodiversity, pollution of the air, water, and soil, and the loss of soil productivity as well. So many factors are occurring, and undoubtedly machine learning and artificial intelligence can help us to unravel some of these. And let me give you one example of where we're beginning to apply that, and that is in trying to synthesize the evidence that's coming out. Because, you know, traditionally what we used to do is we do these kind of systematic reviews of a particular topic. So in family medicine, for example, a new treatment comes out. So you do a systematic review of all the studies that have addressed that particular treatment, and you try to then summarize the total effect on patient outcomes. But of course, what we're dealing with here is a massive increase in the literature. So, for example, a recent review we did, about 7,000 articles to screen, and that's and some are even bigger than that. So doing that by hand is a massive job. And what we're trying to do at the moment is to develop machine learning approaches, which will help us to kind of screen out the papers that we really want, which are really robust, they're good quality science, and they address the kind of question that we want to study at the time, or learn about. Obviously learn about with a purpose, learn about in order to develop better actions, either adaptation or mitigation. So I think increasingly these machine learning approaches will help us to undertake what some people have been calling living reviews. So you don't just want to leave a review, because in 2 or 3 years' time, it'll be out of date. So we need to continuously update these reviews. And we think the machine learning can help us. It doesn't take humans out of the picture. You still need humans to train the machine learning approaches to make sure that it's actually selecting the outcomes and papers that you want. But it does offer an opportunity to streamline the process and also to bring it in a way that it can be almost immediately responsive to changes in knowledge. At least that's our aspiration, and that's what we're working for at the moment.
Thanks, Andy. I'll run through this 3 more questions here, and I'll just put them together, and whoever wants to jump in can respond. So under the theories of complexity, I start from the idea that a great formula is inter and transdisciplinary work to have an educational impact or even on activities from childhood, seeking to educate the population at this age. Any thoughts on this? And this,
Yes.
or, sorry, someone is.
Yes, I would agree, Dermot, I would agree with Gad's point. I think education is key, and being informed from correct sources and official sources of evidence and science. And this begins in school. It begins very early. And we also, as well as educating the children, we need to help educate the parents so the children can help bring their new learning back to the family, back to the parents. Although planetary health is a new science, it's already coming in to the undergraduate curriculum in many of the universities and in some of the medical schools. And many of the universities are introducing planetary health and climate change and sustainability into regular courses, not related to health. So I think that this is a very important move.
Thanks. And next question says, temperature can be easily measured. What about air pollution? How could we help it to be transformed in easy understood concepts such as cigarette consumption?
Yeah, I can address that. I hope I'm unmute here. So traditionally, air pollution monitors were very expensive central things run by governments or government agencies. There are now low-cost sensors that cost. You can get a very good low-cost sensor for $200 to $250. They can be plugged in and feed in the results into your computer network. My vision is that every health center should have a low-cost sensor. It's a tremendously, I think, important way to translate the environment into the community, into the health of the community. The low-cost sensors are not yet accurate enough to be used in primary research, but in terms of citizen science, where this information is used by healthcare professionals and fed into educational systems to talk about air in the community, they're a very, very useful tool. And I think WONCA should explore this further with the idea of providing or help making low-cost sensors one of the like the stethoscope and the blood pressure monitor part of a community health center.
Well, may I ask you a question that in order to sensitize our patients, well, air pollution in my area, I live in the southeast of Spain, and here also on behalf of WONCA, executive board, but I'd like to ask you one personal question. In my area, in my region, the most intelligent measure by our politicians is not measuring air pollution. So we've got very few machines to measure air pollution. Well, when we manage to have the air pollution information, perhaps we don't feel it very close to our ways of understanding. So it would be very good to know there's high pollution, but that is as if you had smoked a certain number of cigarettes. That is a better argument to try to convince our patients about what is happening in the air and all around. So are there any studies in which we could translate air pollution into cigarette consumption?
There's certainly there's a WHO tool that will take where you can plug in your air pollution and figure out the mortality and morbidity, the burden of health from the air pollution, and that's available. It takes a little bit of training, but it's not a difficult tool to learn. And offline, I can help you with that. There are people who have equated air pollution with the burden of cigarettes. There's a thoracic surgeon in India who talked about the fact that every child in Delhi is probably smoking a half a pack of cigarettes a day because of the burden of air pollution, and he's seeing it in his discipline. But I defer to Andy. I don't know if there is I don't know of any easy way, but it's an interesting idea to translate the air pollution burden to the number of cigarettes smoked per day.
Shall I chip in? Yeah, I mean, yes, I think
please.
it's certainly one approach. And I haven't got the numbers would depend very much on what level of air pollution you're exposed to, of course. So it would have to be tailored to the local level of air pollution. But one point I would want to make is that there is no safe level. And all the evidence, recent evidence, suggests that levels we used to think were pretty safe are actually damaging to human health. And that's why the WHO has reduced the level, the kind of safe level, if you like, of air pollution. So there is no safe level, of course, and 99% of the world's population is exposed to air pollution, particularly these fine particles that get deep into our lungs and also affect our bloodstream. There's no safe level. 99% of the world population are exposed to excessive levels. And of course, one of the reasons that we don't necessarily hear much about that is because sometimes it's inconvenient for politicians, because then they have to implement policies which may get some public opposition. For example, less burning of less use of polluting vehicles, for example. And we know that it's really important to tailor these policies in a way which anticipates some of the opposition and really ensures that the public are aware that there are important impacts on their health and that there are benefits from reducing this air pollution exposure. I also just wanted to briefly comment on the earlier question about transdisciplinarity, if I may, because I think it's such an important point. And, I think family doctors are very well aware of the need for transdisciplinarity because they're not sort of very narrow biomedical practitioners. They have a much broader perspective, thinking about the patient and the family in the context of their social environment, their physical environment, and of course, in terms of the context of the healthcare system. So transdisciplinarity, in a way, comes kind of naturally to the family doctor. And that means that we have to have respect and knowledge about different disciplines. We have to work in a way which encourages different disciplines to talk to each other, both in terms of the public health professionals and the primary care team, but also when it comes to medical and nursing schools, bringing in disciplines that we may not have traditionally consulted, like people who understand natural systems, ecologists, like anthropologists who understand how culture impacts on health and humanity. So yes, we do need to reconfigure many of our education systems, but I think family doctors are often in a much better position to take on board some of this transdisciplinarity than those who come from a very narrow biomedical background. Thank you.
Thank you. There's one more question, so I think we'll ask that and then maybe finish up there. It's from PLR. Says, I would like to ask the three panelists to share with us what they consider the three most important tips to recommend to patients in our daily consultations to achieve 1 minute for planetary health. This is a concept that Enrique spoke about at Sydney last year, I gather, in family doctor consultations. So maybe we can hear from all three of you on that.
You want to go first? Andre, perhaps?
Andre?
I'm happy
Yes.
to answer Pilar's lovely question. I think it's a lovely one to finish on. I think in the true spirit of family doctors, we regard our patients as, autonomous and that it's important that they decide the change. So we deliver person-centered practical care. So rather than recommend a particular area of lifestyle medicine for them to address, for example, if I recommended stopping smoking. Their issue might be they would prefer to lose weight. Of pick 3, well, pick 1 is the main thing because they need to start small and take small steps towards lifestyle improvement. Of nutrition, which would be predominantly plant-based diet, physical activity, stress management, substance use, including nicotine, social connections, and environmental exposures and sleep hygiene.
Thanks. Maybe Alan then?
Yeah, I think Andre hit the nail on the head. I love the concept of 1 minute for the planet in the consultation. I think the idea is twofold. One is to educate the patient or to join with the patient so that the patient can be healthier, but also make that link to the greater ecosystem. So clearly diet is related, clearly active transportation. Prescription is very important. So part of saying, you don't need an antibiotic for your child in this situation. One way to educate the patient and make them start thinking about the link to climate change is to say it's good for you and it's good for the planet as well. So I think there are a number of ways like that where we can talk about, counsel and join with the patient about what's good for them, but what's good for the larger planetary system as well.
Yeah, well, just to build on those remarks, and I agree with them entirely. I mean, it's not about enforcing change on anyone, that won't work, but it's about co-creating health and working with the patient as the ally, patient and the family, of course. But I think this creation of knowledge and awareness about the links between our personal health and the health of the planet more broadly is so crucial. And I think that can be imparted in a number of ways. One, of course, is just by sharing information about local environmental hazards. For example, if you've got an extreme heat event coming up, then when you're talking to elderly people, you can also talk to them about, well, how can you protect your health and the health of your loved ones in the face of extreme heat? What can it do? And why is that extreme heat coming? Why is it now more frequent than it used to be? So that's an opportunity just to share that knowledge with patients. As we've heard from previous 2 speakers, then there's the co-benefits, the benefits of climate action, which can be beneficial to the patient, but also beneficial to the planet more broadly. And I think that's, again, those kind of win-win strategies are, I think, much better than the kind of negative messages of doom and disaster, which are very prevalent, but I don't believe that they change behavior necessarily very effectively. So it's working with patients and with the families to co-create potential solutions. But also, patients have their own networks, and so they can also be advocates for change within their own family networks. So how do they communicate some of these messages to their own family networks? That's a matter for them, of course, but empowering them to take on that broader role can sometimes be appropriate as well.
Okay, thanks very much.
Thank you. Thank you very much.
We've gone a couple of minutes over time, but I think we'll leave it there. Thank you very much, everybody, for coming. And again, apologies about that. World Family Doctor Day is next Sunday, 19th of May. And there's some resources, again, in the chat for anybody to follow up on. And thanks very much again to all of our speakers, and have a nice weekend.
Thank you very much.
Bye-bye.
Thank you. Thank you very much. Bye.
Thank you.